Hi children, in this video I have clubbed all the diseases of chapter 17 related to the respiratory system, 18 circulatory system and 19 excretory system. So when you learn, also learn the diseases together. So first let's check the diseases related to the respiratory system. Some important disease of the respiratory system are listed here. First, asthma. What is asthma? It is the inflammation of the bronchi and the bronchioles. We know what are these bronchi and the bronchioles. The trachea, when it reaches the fifth vertebra, it divides into the right and left bronchus and enters the lungs, where it divides and redivides into finer branches. This entire tube system gets inflamed. The primary bronchi, secondary bronchi, tertiary bronchi and the bronchioles all get inflamed, that is swollen up. So here there is a picture showing the normal bronchi with the abnormal inflamed bronchi. This is the normal. You can see the lumen is widened because the bronchi is not inflamed. But look at this. The bronchi is inflamed. See, it's very thick. It's so thick that the lumen becomes very narrow and the person has difficulty in breathing. And this difficulty in breathing is what is called wheezing. You all have seen asthmatic patients, they wheeze. There's difficulty in breathing. The reason is because of the inflammation of the bronchi and the bronchioles. Actually, the bronchi and the bronchioles, the lumen should be wide. So there's easy passage of gases. But what happens in these patients, the lumen becomes very narrow because the bronchi and the bronchioles have become inflamed. So, there is this difficulty in breathing. This is a condition called asthma. There are many reasons to it. We are not going to the reasons for asthma, the conditions. Next disease is emphysema, and it is very common among cigarette smokers, especially the chain smokers. We know where is the gaseous exchange occurring. It is occurring at the alveolus. So, the alveolus, we know it is highly vascularized and thin walled. That is a very, very important property because this exchange of gases, oxygen from the alveolus should get out into the blood, and from the blood carbon dioxide should enter the alveolus. So, this alveolus is very important. This membrane surrounding the alveolus should be very thin. But what happens in these persons who go for cigarette smoking continuously, at the end what happens? They have damaged alveolar wall. So, we can see, again I am zooming through the alveolus of a normal person and the person having emphysema. In the normal person, see, look at the alveolus with thin walls. Look, you can see well defined thin vascularized walls. But in the case of the person having emphysema, you can see the walls gets damaged. See, look at the walls. I am going to highlight it with yellow color so you can see the walls are damaged. They have lost the elasticity. So, this is a situation where the person who is a chain smoker, the alveolar walls get damaged and the elasticity is lost, and this diffusion between or exchange of gases does not take place properly. And the third is an occupational respiratory disorder. Occupational respiratory disorder. This disorder is very common to those people who are involved in such occupation, like those working the stone quarries. They have to crush, grind, break the stones, and therefore they expose the dust particles. And for prolonged exposure, due to this prolonged exposure, damages their lungs. Initially it is not a problem, but prolonged exposure results in ORD. Even their defense, we all are endowed with a defense mechanism that protects us from dust particles. You know it. Our respiratory tract, right from the nostrils till the trachea, bronchi, bronchioles, is lined with mucus. The reason of this mucus is to trap the dust particles. And also there are the hairs that are lining our nostrils to filter the air. So, these two are a part of our immune system that defends us from these dust particles. But here it goes beyond the capacity of the defense mechanism. Our defense mechanism cannot cope up in such situation because he is prolonged exposed to these dust particles, because it is part of his work. He has to live. So, it is his occupation, and he right from morning to evening, if he is not using a mask, he is exposed, and finally what happened? It is beyond the capacity of his defense mechanism. What happened? The dust particles are inhaled and get deposited in the lungs, and we see a condition where the lungs get inflamed, and finally it results in fibrosis, that is proliferation of the fibrous tissue. It is very chronic and very dangerous. So, zooming through a normal lung and the abnormal lung. See, in the normal lungs you can see the pleural membrane are very thin, and there are two pleural membrane with the pleural fluid in between, and this elasticity of the lungs, this vital capacity is high, tidal volume is high, and functioning is good. But look at the person who is exposed to such particles, dust particles, etc. for a period of time, which is due to his occupation, he gets this disorder called cystic fibrosis. Okay, the elasticity of the lungs get decreased because of the inflammation and fibrosis, that is proliferation of the fibrous tissue. Okay, you can see lots of the dust particles, which in a normal person is filtered by the mucus and the hairs lining the respiratory tract, does not occur in that case. In this case, where he is exposed continuously, mainly due to his occupation, to dust or fibers of cotton, etc. It is an occupational disease. This occupational respiratory disorder is mainly due to the occupation. Because of the occupation, he is exposed for a prolonged period of time. Okay, so I hope you have understood the main respiratory disorders as asthma, emphysema, and occupational respiratory disorders. Next, moving on to the disorders of the circulatory system. First disorder, which is very common among us, is hypertension, high BP. The normal blood pressure is 120/80. This can be said as 120/80. This 120 indicates systolic pressure, or in simple terms, contraction pressure or pumping pressure, and 80 represents diastolic pressure or resting pressure. So, this figure is very important, 120/80. If a person is having equal to 140/90 or more than 140/90, he is having high blood pressure. He should be very careful. It should be brought under control, or else it will affect his vital organs like the brain and the heart. So, this situation is known as hypertension. The reasons may be many. Second disorder is CAD. I wish to take CAD, angina, and heart attack together. These three diseases I am going to take together because these three diseases are affecting the coronary artery, which is supplying the cardiac musculature. You know, there is a separate circulatory system other than the systemic and the pulmonary circulation, the circulation to the heart muscles, the cardiac musculature. It receives oxygenated blood through the coronary artery, and the deoxygenated blood is drained through the coronary vein. So, there is a separate system supplying and draining blood from the cardiac musculature, and that system is known as the coronary circulation. Now, these three, CAD, angina and heart attack, are affecting the coronary artery. Which artery? Coronary artery, not the pulmonary artery or the aorta or any other artery. It is affecting the arteries that are supplying the cardiac musculature. So, there is a representation of the blood vessel. See, the blood vessel that is supplying the heart, that is the coronary artery. Look at the first picture, A. What is happening is you can see plaques are built up in the lumen of the coronary artery, see, which is represented in yellow color. Plaques of calcium or fats, cholesterol, even some fibrous tissue gets deposited, and as a result, look at the lumen. See, it gets deposited, and finally you see the plaques makes the lumen of the artery narrow and narrow. Specify which artery? The coronary artery. So, CAD or coronary artery disease is also known as arteriosclerosis, where the lumen of the coronary arteries becomes narrow. Why it's becoming narrow? Because of the deposition of calcium, cholesterol, etc. on the walls of the coronary artery. Remember which artery? Coronary artery. This gets deposited. As a result, the lumen becomes very narrow. Narrowing of the lumen of the coronary arteries. Very, very important. Narrowing of the lumen due to deposition of calcium, cholesterol, etc. That's why it's better after the age of 40 to get a periodic check of the cholesterol in your blood, because the chances of this to get deposited in this artery, when it's deposited in this artery, it can lead even to heart attack. You can see that. So, this is the first situation, coronary artery disease. Next is angina. Angina is a situation where the person experiences acute chest pain, off and on chest pain, but he does not take it seriously. He thinks it is some obstruction due to gas or due to some other problems, and take some medicines and get over. But this pain is an indication of angina. Angina is a condition where no enough oxygen is reaching the cardiac musculature. Again, it is the coronary artery. So, here there is another picture depicting the coronary artery, continuation with coronary artery disease. Here also plaques are developed. See, with yellow I am showing plaques of calcium, cholesterol, etc. are formed on the walls of the artery. The lumen becomes narrow, same situation. But here becomes worst is that oxygen, you look at the number of RBCs. Here in the picture you can see, if I am indicating in blue, look at the RBCs that are going in this direction. All the RBCs are going. Though the lumen has become narrow, the RBCs are reaching the other end, supplying the supplying the cardiac musculature. RBC supplying oxygen. We know the RBCs are the carriers of oxygen because hemoglobin is present in the RBCs. So, but whatever obstruction is there, the RBCs are reaching the musculature. They are reaching the muscles. So, it's safe. The muscles are receiving oxygen because RBC. But look here. Here there are a number of RBCs, but look here this side only few RBCs have reached the other side. So, there is insufficient supply of oxygen to the cardiac musculature, which means that the other components of the blood is reaching, but what is held back is our RBCs. RBCs definitely what is inside hemoglobin, which is a carrier of oxygen. So, these people, they do not get sufficient oxygen supply to the cardiac musculature. Again, it is a drawback of the coronary artery, same reason, deposition of calcium, cholesterol, etc. and narrowing of the lumen. Not only that, because of this plaque building up, the oxygen, the RBCs are held behind. They are not made to pass and reach the cardiac musculature. Therefore, there is insufficient oxygen to the muscles. The muscles are shown this side. There is insufficient supply of oxygen to the cardiac musculature. Cardiac musculature, they are cells that require oxygen for cellular respiration, insufficient oxygen. So, it results in this condition called angina, which is very much pronounced and shown with slight chest pain. Next, another disease that is affecting the coronary artery is heart attack. Now, here you can see in the third figure, you can see again the plaque burst. It is more chronic. The plaque builds up because of the deposition of calcium, cholesterol, mainly of calcium, and see the lumen becomes narrow and narrow. The cavity becomes very narrow, and finally you can see the plaque breaks. And when the plaque breaks, what happens? It becomes a heap here, and it blocks the artery. Full stop. There's a big block here because the plaque that was formed due to the deposition of calcium or cholesterol breaks and gets piled up, a heap. So it blocks the blood flow. And see this arrow? There's no flow of blood this side to the cardiac musculature. This situation is known as heart attack. The cardiac musculature does not get adequate blood supply. So once again, the three disorders connected to the coronary artery, that is the artery supplying oxygenated blood to the cardiac musculature. The first is CAD. That is simple as in the sense with regard to the other two. It is just the narrowing of the lumen of the coronary artery due to the deposition of calcium and cholesterol. Second situation, little more chronic, that is angina. That is, no sufficient oxygen is reaching the cardiac musculature. Again, the reason is the same. There is a build-up of the plaques, and when the plaques goes on growing or building or accumulating due to calcium and cholesterol, what happens is there is no sufficient oxygen supply to the cells of the cardiac musculature. And as I told you, angina is the symptom is acute chest pain. And last we have heart attack, the most chronic. What happens is the plaque that is built up. In both the cases we see the plaque, but now the plaque goes beyond control, meets and breaks, and once it breaks, the supply of blood to the cardiac musculature is obstructed. There is no supply to the cardiac musculature and results in heart attack, sure death. Now we are having the next, the fifth and sixth, we are having heart failure and heart arrest. Heart arrest is also known as cardiac arrest. Okay. Now we always interchange these three: heart attack, heart failure, cardiac arrest. We think these are synonyms of one another, but they are totally different. In heart failure, what is the function of a normal heart? The function of the heart is to pump blood to the different organs. But what happens? The heart stops pumping effectively. It's pumping but not efficiently. The atria are slowly pumping and the blood is pushed to the ventricles. The ventricles are slowly pumping and pushing the blood to the aorta and the pulmonary artery. Effectiveness is lost. So in heart failure, the heart is not pumping blood effectively. That is also fatal. And last we are having cardiac arrest or heart arrest. Here what we know is our SA node, the pacemaker which initiates heartbeat, stops, and this results in the heartbeat stopping. So it's simple as such. Heart arrest or cardiac arrest is heart stops beating. If it stops beating, definitely it will stop contracting. If it stops contracting, it will stop pumping of blood, which means the person is dead. So once again, the diseases of the circulatory system, starting with the most common disease, hypertension. It should be controlled. The normal blood pressure is 120/80, but if it goes beyond 120/80, like say 140/90, it results in a condition called hypertension. It is very important. These persons should control the hypertension by way of diet and exercise, or else it will affect the vital organs like the brain and the heart, and finally it will be fatal. Then we have three diseases you have to learn together: CAD, angina and heart attack. Why I told you to learn it together? It's all affecting the coronary artery, the artery that supplies oxygenated blood to the cardiac musculature. In the first case called CAD, there is the plaque building up in the coronary artery and therefore the lumen decreases. In the second case called angina, what happens is not only the plaques build up, there is insufficient oxygen reaching the cardiac musculature. And the third case, heart attack, is the plaques cracks and breaks and heaps and clot the blood, and therefore when there is a blood clot, there is a block, and therefore the blood does not reach the cardiac musculature. These three you have to learn together because it is affecting the coronary artery, that is common to 3. Then heart failure is the heart does not efficiently or effectively pumps the blood. We know the main function of the heart is to pump blood, that it is not doing effectively, then it is called heart failure. And last we have cardiac arrest or heart attack or heart arrest, where the pacemaker stops functioning. So the heart stops beating. The heart stops beating, we know the cascade of events stops. That is, the pacemaker does not work, there is no generation of impulse, there is no heartbeat, there is no contraction. When there is no contraction, there is no pumping of blood, and finally the person is dead. Next we will move on to the list of diseases coming under the excretory system. Some important disease. The first disease, uremia. We know we are ureotelic animals, which means the major nitrogenous waste is urea, and this urea is very toxic. It should be excreted from our blood through the urine with the help of kidneys. But in the persons having kidney failure, complete kidney failure, in such cases this urea remains in the blood. It is not filtered into the urine. The other constituents are present in the urine, but urea, which is a major constituent which should be got rid of in the urine, is still remaining in the blood. Okay, such a condition is called uremia. So it is accumulation of urea in the blood. So what is urea? Accumulation of urea in the blood is a condition called uremia. It should actually be excreted out in the urine with the help of the kidneys. So the solution to this is dialysis, hemodialysis. In hemodialysis, a convenient artery, from a convenient artery of the patient, the blood is drained out into a hemodialysis machine. I am going to zoom that machine. From a convenient artery, as I said, the blood is drained. This blood contains a lot of urea, okay, which should not be in the blood. So it is drained and it goes into this dialysing machine. The construction of the machine is, this unit comprises of cellophane tubes. And a dialysis fluid. Very important is the dialysis fluid, indicated with yellow. Dialysis fluid. The constituent of the dialysis fluid is exactly equivalent to the plasma. Okay, correctly equivalent to the plasma without any nitrogenous waste. Now the blood, as it goes through the cellophane tube, see the blood goes through the cellophane tube, what happens is the nitrogenous waste which is present in the blood moves out, because a concentration gradient, I told you that dialysis fluid does not have nitrogenous waste. So what, there is a tendency of movement of nitrogenous waste or urea from a region of high concentration, which is inside the cellophane tube, to a region of low concentration, that is the dialysing fluid. Dialysing fluid is represented by yellow color. So there is movement of nitrogenous waste from the cellophane tube into the surrounding fluid, the dialysing fluid. So the setup is two very important components, the dialysing fluid, and second component is the cellophane tube. The cellophane tube is porous, in the sense it is a semi-permeable membrane permitting the movement of nitrogenous waste, and there is a concentration gradient. Why there is a concentration gradient? Because the composition of the dialysing fluid is just plasma, no nitrogenous waste. So when this person's blood enters, what happens is blood is rich of urea and other uric acid and salt, water, etc., which are the other constituents, mainly urea, and there is no urea in the dialysing fluid. So as it moves through this cellophane tube, what happens is movement of urea from a region of high concentration, that is within the cellophane tube, to a region of low concentration, that is the dialysing fluid. So finally after dialysis, so this entire process is over. Finally the blood is cleared of urea, the blood is cleared of urea and it is supplied back to the patient's vein. So it was drained from the patient's artery, and after purification or after the urea is removed or cleared, the clear blood is now supplied back to the patient through a vein. But all this is before administering an anticoagulant. So before the blood could pass through the cellophane tube, we know our blood has a clotting factor and it will result in clotting. So to prevent clotting of the blood, which will obstruct the flow through the cellophane tube, what is administered is an anticoagulant. And the anticoagulant used is heparin. And remember, in leech there is this heparin. That's why when leech bites you, what happens is excess bleeding because of this heparin. There is no clotting agent. It will go on continuously bleeding and bleeding, okay, because of this presence of this chemical called heparin. So before the blood could be drained into this dialysing fluid or unit, what is done is it is administered with anticoagulant. So coagulation or clotting is prevented. And then after clearing the blood of urea, this cleared blood, see, the cleared blood is drained to the patient after administering a coagulant. Now it needs the property of coagulation, a coagulant, anti-heparin. So don't interchange the two. Heparin is an anticoagulant. Remember that heparin is present in leech. That's why once we are bitten by the leech, what happens? There's excess blood flow without clotting, like a hemophilic patient. So remember, heparin is an anticoagulant which is administered before the dialysis. And after dialysis over, before the blood could be supplied back to the patient's vein, what a coagulant is administered. And the purpose is to bring back coagulation, and that is by putting this component called anti-heparin. Okay. So anticoagulant is heparin and coagulant is anti-heparin. And now the patient's dialysis is complete and the blood is cleared of the urea, which is a toxic substance. And it depends upon the intensity or the situation of the patient, the number of times he has to undergo dialysis. That is prescribed by the doctor depending upon the situation. Sometimes kidneys become a complete failure. It does not work. In the first case, we can see at least the functioning of the kidney is at least 5%, more than 5%. The kidneys are doing some function. So just to remove urea, we are going for dialysis, that option. But in the second case, what is called renal failure, kidney failure, total failure, the kidney is not doing its role, complete failure. In that case, the only option is to go for a kidney transplant. And kidney transplantation is usually done among close relatives, so that there is no rejection, or else our immune system will reject the foreign kidney and lot of rejection reactions will occur. So it's preferred that we take a kidney from the closest relatives, siblings, then only parents, and then others. Okay. Or now we have donors, and therefore immunosuppressants are administered, which are very, very expensive. That is kidney failure or renal failure, where the kidney does not do any function. The only remedy is to go for a kidney transplant. Third, renal calculi. In renal calculi, your stone formation, you have heard this, very common, stone formation occurring at different parts of our kidney. Now I am going to show where usually the stones are formed. Stones can be formed at the ureter. See, this is the ureter. See, the stone can be formed at the ureter. It can be formed at the pelvic region. Renal pelvis is the pyramid shaped funnel shaped region, or it can be formed at the calyx region. We know what is a calyx. So, sometimes the stones can be formed at the calyx, then it is known as calyceal stone. If it is formed in the pelvic region or in the pelvis, renal pelvis, it is known as a renal pelvic stone, or if it is formed at the ureter, upper ureter, it is known as the upper ureteral stones. These stones cause a lot of pain at the lower back abdomen. It is very, very severe. Sometimes the stones can be formed, if I am continuing with this to the urinary bladder, sometimes the stones can be formed at the urinary bladder or even at the urethra. We have mild urinary infection because stones accumulating in the urethra. Urethra can be rectified, urinary bladder also to some extent, but it is not so painful. But when stones are accumulated in the ureter, in the pelvic region and the calyx region, there is no remedy, is only drinking water and flushing it out, or undergoing some drips to flush it out. But it causes a lot of pain. Though the stone is small, it causes a lot of pain. So, that is called renal caliculi, and this is crystallized salts of oxalates, salts like oxalates. And the last disorder related to the excretory system is inflammation of the glomerulus. We know the glomerulus functions to filter the filtrate at the starting. The first stage of urine formation is glomerular filtration, and we know that what is being filtered, the constituent of the glomerular filtrate. The glomerular filtrate is exactly the blood plasma minus proteins. You have to remember this composition. So, this is the role of the glomerular filtrate or the glomerular filtration, which is occurring, which is taking place in the glomerulus in the Bowman's capsule. So, just recap of the Bowman's capsule. This is the Bowman's capsule. You have the cluster of capillaries in the concavity, and through this the blood is passing at high blood pressure because the capillaries are very fine, it is flowing through high pressure, and filtration is called ultrafiltration. And when the blood is flowing through the glomerulus, see the pink is the glomerulus, whereas the blood is flowing, what happens? Something is getting filtered, the glomerular filtrate. And as I told you, the composition of the glomerular filtrate is exactly as the blood plasma minus all the proteins. Okay, so this step is done in the glomerulus. But what happens when the glomerulus gets inflamed? This glomerulus, which is narrow, gets inflamed. Inflamed means it's a condition where the capillaries of the glomerulus becomes very narrow. So, it will not do its function. There is an anomaly here. Okay. We know the capillaries, though it is very thin blood vessel, the capillaries should be wide, but what happens is inflammation. This function does not take place. Glomerular filtration does not take place properly, and as a result, the urine that is formed will contain, the urine can contain RBC. You can see the urine will be red in color because it contains a lot of RBC. The function of the glomerulus is not done. The glomerulus should do the function of filtration, where it should filter out the RBCs. The RBCs should be filtered. It should not come, here the RBCs should not come at all. The RBCs should be retained in the blood, but what happens is it does not do its filtration. So, all the RBCs gets into the filtrate. See, all the RBCs gets into the filtrate, and therefore the urine formed contain a lot of RBCs. Such a condition is called hematuria. The blood is red in color. And also because of this glomerular inflammation, it will also result in proteins. The proteins also will not be filtered. I told you the plasma should be devoid of protein, but plasma also, the proteins also gets into the Bowman's capsule. And finally, you have the urine rich in proteins. Proteins, we can't afford to lose proteins from our body. It's required for growth. but what happened, all the proteins are lost because the glomerulus is not doing its function, it's inflamed. It does not do the function of withholding the proteins, and other constituents only should get into the Bowman's capsule. But what happens, RBCs and the proteins does not get filtered, they are drained into the filtrate. The glomerular filtrate will contain these two constituents, RBC as well as proteins. So the urine will contain a lot of proteins. It can either be proteins or only RBCs. In these two situations, what happens is when we report to the doctor of such a situation that the urine looks red in color like blood, then the test is taken and it's found that the glomerulus is inflammation, so it's not doing its function of glomerular filtration. Even also when the urine is thick in consistency, rich in proteins, and we have other symptoms like fever off and on, when the urine is tested, the urine contains a lot of proteins. We cannot afford to lose the proteins in the urine. It should be retained in the blood. So there is also an indication that our glomerulus is inflamed. So recap of the disorders related to the excretory system. Uremia, as I told you, urea is a toxic waste product that should be excreted out through the urine with the help of the kidneys. But in the patients having uremia, the blood will contain urea. In that situation, the only option is hemodialysis. And I told you the working of hemodialysis machine. The machine is a unit which comprises the cellophane tube and the dialysing fluid. The blood is drained out to a convenient artery after administering an anticoagulant, heparin. Then the blood passes through the cellophane tube, and as you know, when it passes through the cellophane tube, there is a movement of molecules from a region of high concentration to a region of low concentration. Which molecule? Urea. And after that, after urea is completely cleared, this cleared blood is drained back into the patient's vein. And before draining back into the patient's vein, the coagulant is placed back. Coagulant is administered, and here we use an anti-heparin. Second, renal failure is a situation where the kidney totally fails, and this is the picture of that kidney which is completely diseased, and there is no other alternative, only to go for a transplant. See, this is a diseased kidney. Look, diseased kidney. This is a normal kidney. So the only option is to go for a kidney transplant. And as I told you, whenever a person undergoes transplantation, our immune system recognizes self from non-self and shows a lot of rejections. So it's always better to get the kidney from a close relative, if not a donor. But in that case, immunosuppressants drugs, a lot of immunosuppressant drugs are used, which is very, very expensive. Third, we have renal calculus. It's the formation of crystallized salts of oxalates in different parts of a kidney, namely, if it's found in the calyx, it is called calcareal stone. If it's found in the pelvic region, as renal pelvis is called the renal pelvic stone. If it's found in the ureter, it is called the ureteral stone. It can be in the upper ureter, lower ureter. It can also be accumulated in the urinary bladder. It will not be noticed initially. Finally, when it's full only, it will be, that's very little dangerous. If it accumulates in the urethra, it causes urinary infections, etc. So this is formation of crystallized salts of oxalates in different parts of the kidney. It causes pain, severe pain. And last is glomerular nephritis. It's the inflammation of the glomerulus. As I told you, glomerular filtration, the role of glomerular filtration is to bring out filtration at the first level of urine formation, where the entire blood, almost the entire blood is transferred into the Bowman's capsule. That means that filtrate is plasma minus proteins. The other formed elements and proteins are this side, which are necessary in the blood. But what happens when the glomerulus gets inflamed? This process does not take properly. So RBCs, which should be retained in the blood, gets into the Bowman's capsule and gets drained into the urine. Similarly, proteins which should be retained for our body in the blood, it gets drained out through the urine because the glomerular filtration is not doing its role. In that case, we have situations where the blood will be red in color, it's called hematuria, or the blood will be having thick consistency with rich in proteins, is called proteinuria. This can be detected by urine tests. These also can be rectified if detected early. I hope you understood today's list of disorders coming under respiratory, circulatory and excretory systems. Thank you.